Hello, welcome to We Care Wednesday. My name is Megan Branham. I'm a pharmacist here on Taylor Street. And today, what I'm here to talk to you about is allergies. So with warmer weather approaching, spring is just around the corner, and with spring comes pollen, and pollen comes allergy symptoms. So how do we safely treat symptoms at home using over-the-counter products? That's what I'm here to talk to you about today. Oftentimes, especially here in South Carolina, allergy symptoms are triggered by pollen. When pollen invades our body, even though it is harmless, our immune system views it as a dangerous invader and ramps up our immune system to fight it off. This is when we start experiencing stuffy or runny nose, itchy, watery eyes, sneezing, coughing, and sometimes even a sore throat. So how can we effectively and safely fight back? There are two primary strategies that we can use. One, to block the effects of histamine, and two, to suppress the immune system before it even releases histamine. The first class of medications that I'm going to discuss today are what's called antihistamines. So these include Benadryl, Allegra, Claritin, Zyrtec, and Zysol. Now, the first thing that I wanted to kind of discuss with you guys is the difference between Benadryl and all the other ones that I had showed. So Benadryl is what we refer to as a first-generation antihistamine. So basically what that means is that it actually crosses over our blood-brain barrier, causes way more drowsiness than the other ones that I had showed. So when I'm recommending a antihistamine for a patient, I primarily recommend starting with one of the other ones instead of the Benadryl because Benadryl is dosed multiple times throughout the day and there's just that excess drowsiness associated with the Benadryl. Now, keep in mind that everybody's body is different, so one antihistamine that works best for me may not work best for you. So you just got to play around with it and see what works best for you. But when I'm recommending an antihistamine, I usually start off with either Claritin or Zyrtec because both of those are just one tablet once daily. They're not as drowsy and they're oftentimes more affordable because there's generic options available. So the second class of medications I want to talk to you about are ways to suppress the immune system before it even releases the histamine. In this case, we can use corticosteroid nasal sprays. So there's two that I was going to show you today. We have Nasacort, and then this one right here. This one is one of the generic options of Flonase. So Nasacort and Flonase. So each one of these, you can use them one of two ways. One, you can use one spray in each nostril twice a day, or you can actually use two sprays in each nostril once a day, with 4 sprays being the max that you'd want to use per day. So both drugs, so both of these antihistamines, the tablets and the nasal sprays, can be used in combination with each other in order to fight back our immune system and help alleviate some of these allergy symptoms. However, I would not recommend using them any longer than a month over the counter without consulting your physician or an ENT. Well, that's it for We Care Wednesday. Thank you for tuning in. I'll see you next time.